Welcome to this talk about your jaw and physiotherapy. Today, I just wanted to share with you a strong relationship, possibly the patient I came across. That is, it was quite an interesting case where um, a thoracic outlet syndrome was manifesting into jaw symptoms, where it was causing heaviness in her jaw, uh, as tightness, occasionally pain, and it's clicky, clenching, grinding through the night. And it didn't really matter whether she was stressed or not stressed. And it was very, very hard to shake it off. So I just wanted to mention if there are people out there who are suffering from thoracic outlet syndrome related jaw symptoms such as tightness, clickiness, unshakable, heavy sensation around your face, especially around the cheeks and the jaw, um, and potentially some pain, please seek help from someone who can help you with posture, jaw, and especially thoracic outlet syndrome. Thoracic outlet syndrome can be very, very difficult to diagnose because there are many spots, up to about 8 different locations where it can actually compromise the nerve supply due to the tightness in the muscles, and in a severe cases, in rare case like 10% or less, it can actually also obstruct the blood flow that are coming along together with the nerves, but they are usually deeper than the nerves, and the nerves tend to get affected most significantly. So these people can have symptoms down the arm because there's usually some obstruction that's impinging the nerve because of the muscle tightness or because of the poor posture, tractioning, or previous trauma to the neck and shoulder and head can predispose you to certain conditions or thickening in the soft tissues such as muscles and the tendons where the nerves delicately run through. In here, up to about 4 locations around the neck, in the muscles usually called the scalenes, but also in this front part here in the pectoralis muscle, especially the pectoralis minor, it can have some obstructions or impingements where it can actually pinch the nerve, or muscles have become thicker and that actually bears down on the nerve that's passing through what we call a brachial plexus down this way. So you could get symptom down the arm, towards the fingers. In general, further down the symptoms go, further down the symptoms go to the fingers, to the tips, the more distal, meaning down the chest. If it's going into the shoulder blades at the back, but the pain tends to move with the thoracic outlet syndrome, but if it tends to be consistent around the shoulder blade and inside part of the shoulder blade between the spine, central spine, and the shoulder blade, and it just moves around in that area, and it can cause headaches, it certainly is more to do with the scalenes. But that's a general rule, and it could be a combination of both. And again, as I said in the first instance, in some cases, it can manifest into other symptoms up the head and the neck, and it can also contribute to jaw pain, tightness, heavy feeling, clenching, grinding. So I just wanted to share that with you as part of what I see. I wanted to share to keep people updated. And if you are suffering from anything remotely similar to what we've just talked about, yourself or someone in your family or friends that you know, please send them to someone like physiotherapist who has special interest in treating thoracic outlet syndrome, jaw problems, migraines, headaches, things like that. Obviously, after you check with a doctor, appropriate doctor, that it is all clear to do so. So, thank you for watching this episode of Jolkins Physiotherapy, and I'll see you in another episode. Now, if you like these videos, please give us a thumbs up or please subscribe so when the next video comes out, you'll be notified. So happy rehab. Cheers.